Most people have no idea how often colon cancer goes unnoticed until it's in the most dangerous stage. The shocking part. Its early symptoms look so normal that people mistake them for acidity, gas, weakness, or simple stomach issues. But ignoring these tiny signs is exactly why colon cancer remains one of the fastest-growing cancers worldwide. In this video, we'll look at the 20 early warning signs of colon cancer that you should never ignore. These symptoms can start appearing weeks, months, and sometimes even years before the disease becomes severe. But most people don't recognize them in time. Just imagine this. If you understand these symptoms today, you'll instantly know whether you're safe or if you need medical attention. Stay with me until the end, because by the 20th symptom, you'll be able to say with confidence, "I'm safe," or "I need to get checked immediately." And yes, the last symptom is something more than 95% of people ignore. And this one sign alone is the reason so many colon cancers are detected late. Before we break down the 20 symptoms, there's something important you should know. Many of these signs can also appear due to common digestive problems like acidity, IBS, constipation, or infections. That's why it's crucial to stay till the end, because I'll also explain which symptoms are extremely dangerous and which combination means you should see a doctor immediately. Before we begin, tell me in the comments, what's your name, where are you watching from, and which issue bothers you the most? I read every comment, and I'll guide you with the right information. If you find this video helpful, make sure to like and subscribe for more life-saving health tips. Alright, let's get started with the first early warning sign. Number 1. Changes in bowel habits. Changes in bowel habits are often one of the earliest signs that something may be wrong inside the colon. The colon's main job is simple but essential. It absorbs water from digested food and forms solid waste, moving it forward in a smooth, coordinated rhythm. This natural movement helps you maintain a regular, predictable bathroom routine. But when a tumor begins to develop inside the colon, it can quietly disrupt this process. Even a small growth can interfere with how waste moves through the intestine. The tumor may slow down certain parts of the bowel, irritate the colon's lining, or interrupt the normal muscle contractions that push stool forward. As this internal disruption builds, people often notice that their usual bowel pattern starts to shift. You may feel that your body isn't following its normal rhythm anymore. Your bathroom schedule may change, the timing may feel different, or the process may feel less natural than before. What was once predictable may suddenly become irregular in ways you can't explain. Over time, this change becomes noticeable enough that it feels out of character for your body. It can make daily routines feel slightly off, leaving you with the sense that your digestive system is not working as smoothly as it used to. This isn't just a short-term digestive issue. It is the colon's way of signaling that something deeper may be affecting its function. Number 2. Blood in the stool. Blood in the stool is one of the most important warning signs of colon cancer, but many people ignore it or blame it on something simple. Your colon has a delicate inner lining filled with tiny blood vessels. When it's healthy, these vessels stay protected and sealed, helping waste pass smoothly through the intestine. But when a tumor begins to form inside the colon, it can irritate or damage this lining. As the cancer grows, it may scratch, inflame, or break small blood vessels. This can cause small amounts of blood to mix with your stool as it passes through the colon. At first, this bleeding may be very light, so light that you may not notice it, or you may think it's nothing serious. You might see red streaks on the stool, slight spotting on toilet paper, or a faint reddish tint in the toilet bowl. Many people mistake it for a minor cut, or think it is from straining, but the colon is showing a sign that shouldn't be ignored. Over time, the bleeding can become more noticeable. This happens because the tumor keeps irritating the lining of the colon, causing fresh blood to leak during bowel movements. Blood in the stool, especially when it continues for days or weeks, is the body's way of warning you that something inside the colon may be damaged or blocked. Early bleeding can be one of the first clues that colon cancer is developing, and catching it early can make treatment much more effective. Number 3. Diarrhea. Diarrhea can become a warning sign of colon cancer when it continues for a long time and doesn't follow your usual pattern. To understand why this happens, it's important to know that the colon normally absorbs water from the food passing through it. This slow, steady absorption helps turn waste into a soft but solid form. However, when a tumor starts developing in the colon, it can interfere with this process in a different way. Instead of blocking or damaging the lining, the tumor may irritate the area around it. This irritation can cause the colon to move waste forward too quickly. As a result, the colon doesn't get enough time to absorb water. When this happens, the stool becomes loose and watery, leading to repeated episodes of diarrhea. People often describe it as feeling like their body is rushing everything through. You may feel sudden urges to use the bathroom, sometimes multiple times a day, even when you haven't eaten anything unusual. The episodes may come with a sense of urgency that feels new or unfamiliar. Over time, this constant looseness can make you feel drained or unsettled because your body is losing more fluid than normal. It can also disrupt your day, making you worry about finding a bathroom quickly or suddenly feeling uncomfortable while outside or at work. This isn't simply a stomach infection or food-related issue that clears up in a few days. Persistent diarrhea, especially when it continues for weeks, is the colon's way of signaling that something may be affecting its normal function. Number 4. Persistent abdominal discomfort. Your abdomen is home to several important organs, and the colon sits curled and folded inside this space. Under normal conditions, the colon works quietly, moving waste along without causing any pressure or unusual sensations. But when a tumor begins to grow, it can create a sense of disturbance inside the abdomen. The tumor may press against surrounding tissues, stretch certain parts of the colon, or cause increased sensitivity in the area where it is forming. This internal pressure can build slowly, creating discomfort that doesn't match the usual stomach upset people experience from food or stress. This discomfort can be felt in different ways. Some people describe it as a heavy or tight feeling in one part of the abdomen. Others notice a dull, lingering ache that keeps coming back, even when they haven't eaten anything that should cause irritation. It may feel like something inside is swollen or out of place. Over time, you may start noticing that this discomfort becomes a part of your daily routine. It may not be sharp or intense, but it stays long enough for you to feel that something isn't right. Simple activities like sitting, bending, or even moving around can make you more aware of this uncomfortable sensation. This is not the typical stomach pain that goes away after a few hours. Ongoing abdominal discomfort, especially when it appears without a clear cause, can be your body's way of signaling that something inside the colon may be growing or changing. Number 5. Lump in the abdomen or back passage. Normally, the colon lies deep inside the abdomen, and its shape and position stay steady. The tissues around it feel soft and smooth, and you wouldn't usually notice any kind of mass or abnormal shape when touching the area. However, as a tumor grows inside or near the colon, it can start creating a firm or noticeable mass. This happens because the growing tumor takes up extra space, and the tissues around it may thicken or become stiff. Sometimes this change stays deep inside the body, but in some cases the swelling becomes large enough to be felt from the outside. People often describe it as a hard spot, a firm area, or simply something that feels different from the rest of the abdomen. The lump may not cause pain, and that's why many people ignore it. But its presence can be a sign that a growth inside the colon is pushing outward or affecting the tissues around the rectum or lower abdomen. A lump in the back passage, means rectal area, can also happen when a tumor forms closer to the lower part of the colon. This can make the area feel fuller or thicker than usual when touched or examined. Some people notice it while cleaning the area, sitting, or during a routine checkup. Even if the lump doesn't hurt or bother you, it is not something the body normally develops without a reason. Spotting this early gives you a chance to seek medical help before the cancer spreads further. Number 6. Mucus in stool. Finding mucus in your stool can be an early sign that something unusual is happening inside the colon. Under normal conditions, the colon produces a very small amount of mucus to help stool move smoothly through the intestine. This mucus stays inside the bowel and is rarely visible because the colon is healthy and well-balanced. But when a tumor begins to form, it can disturb this balance. Cancer in the colon often creates irritation in the tissues around it. In response, the colon starts producing more mucus than usual to protect itself. This extra mucus mixes with the stool, making it more noticeable when you go to the bathroom. People often see it as a clear, jelly-like or white, slippery substance on the stool or in the toilet water. This is not the typical mucus that comes with a short-term infection or a mild stomach issue. Instead, it appears repeatedly and becomes a pattern you start noticing more often. The reason this happens is that the colon tries to shield its inner surface from the irritation caused by the growing tumor. The more the area is irritated, the more mucus the body produces to coat and protect the tissues. Over time, this visible mucus can become a sign that the colon is struggling to function normally. Even if you don't feel discomfort or pain, the consistent presence of mucus is a clue that the lining of the colon is being affected in an unusual way. Number 7. Anemia and chronic tiredness. Anemia and long-lasting tiredness can become silent warning signs of colon cancer, and many people don't realize how closely they are connected. Your body depends on healthy red blood cells to carry oxygen to every organ. Oxygen is what gives your body energy, helps your brain stay alert, and keeps your muscles strong throughout the day. When a tumor grows inside the colon, it can slowly affect this system in a different way. Even without visible bleeding, the tumor may cause tiny continuous blood loss inside the body, so small that it often goes unnoticed. Over time, this hidden blood loss reduces the number of red blood cells, leading to anemia. When your blood carries less oxygen, your body begins to feel the effects. Tasks that once felt easy may start feeling heavier. You may wake up feeling tired, even after a full night's sleep, because your cells aren't getting the oxygen they need to stay energized. People often describe this tiredness as a kind of exhaustion that doesn't match their daily activities. Simple things like walking, climbing stairs, or carrying groceries may start feeling more draining than usual. Some also notice trouble focusing, feeling lightheaded, or having less motivation throughout the day. Anemia caused by colon cancer develops quietly, but its effects can be strong and constant. Recognizing this long-lasting tiredness can be a crucial early clue that something inside your colon needs attention. Symptom 8. Feeling of incomplete bowel movements. Normally, when you finish a bowel movement, your colon empties properly, and the nerves inside it send a clear signal to your brain that the process is done. This gives you a natural sense of relief and completeness. But when a tumor begins to grow inside the colon, especially in the lower part, it can disturb this communication. The tumor may create a sense of blockage or crowding, even if stool has already passed. This doesn't mean the colon is fully blocked. Instead, the tumor changes the way the colon stretches and moves, which can confuse the nerves responsible for telling the brain, "You're done." As a result, you may stand up after using the bathroom and still feel like something is left behind. Some people describe it as a pressure, a lingering sensation, or a feeling that the bowel didn't empty completely. You may even return to the bathroom soon after, only to find that nothing more comes out. Over time, this feeling becomes more noticeable and more frequent. It can make bathroom visits feel incomplete or frustrating, and may leave you with the constant impression that something is still there, even when the colon has already done its job. This isn't a result of eating too much, rushing in the bathroom, or everyday digestive changes. It happens because the colon's normal movement and nerve signals are being disrupted by something growing inside the lower bowel. Number 9. Rectal bleeding. It usually happens right at the point where the stool exits the body. The lower part of the colon and the rectum are lined with delicate tissues and small blood vessels that help control bowel movements smoothly. When everything is healthy, this area stays protected and free from irritation. But when a tumor develops in the lower colon or rectum, it can disturb this area directly. As the tumor grows, the skin-like tissues inside the rectum may become irritated, stretched, or more sensitive. When stool passes over this irritated area, even gently, it can cause a small amount of bleeding. People often notice this bleeding after a bowel movement, not mixed with stool, but appearing on toilet paper, dripping into the toilet bowl, or leaving a small stain on the seat. Because the bleeding is happening at the exit point, the color is usually bright red. This makes many people think it's from a minor issue, like straining or a small tear. But in some cases, it is caused by a tumor sitting in the lower bowel. The bleeding may come and go, but it often returns in a similar pattern. Some people notice it only occasionally, while for others it slowly becomes more frequent. Even if it's painless, it still points to a disturbance in the rectal area that shouldn't be ignored. Understanding this sign early can help detect colon cancer at a stage where treatment is Number 10. Maroon-colored or black stool. The colon is responsible for absorbing water from waste and forming stool before it leaves the body. When this process is normal, stool usually appears brown and consistent in color. When a tumor develops in the colon, it can damage the inner lining of the intestine. This damage may cause slow, internal bleeding that isn't always obvious. As blood mixes with stool and travels through the digestive tract, its color changes. Instead of bright red, the stool may appear dark maroon or even black and tar-like. This darker color often means the blood has been in the body for some time, making it easier to miss or ignore. As this hidden bleeding continues, the body slowly loses blood. Over time, this can lead to fatigue, weakness, dizziness, and shortness of breath due to low iron levels. Many people don't connect these symptoms to their digestive system, assuming they're just tired or stressed. Meanwhile, the cancer may continue to grow without being detected. What makes this symptom especially dangerous is that black or maroon-colored stool is often mistaken for a harmless issue, such as diet changes or medication side effects. But it's not something to brush off. This change is the body's way of signaling that something serious may be happening internally. Recognizing unusual stool color as a potential warning sign of colon cancer is critical. While it may seem subtle at first, paying attention to this change and seeking medical advice early could lead to faster diagnosis and significantly better treatment outcomes. Number 11. Unexplained weight loss. Normally, our body maintains weight by absorbing nutrients from the food we eat and using them to produce energy. When everything is working properly, weight changes usually have a clear reason, such as diet, exercise, or lifestyle changes. Colon cancer can disrupt this balance in subtle but powerful ways. As a tumor grows inside the colon, it can interfere with how nutrients and fluids move through the digestive system. The body may stop absorbing enough energy from food, even when eating normal meals. At the same time, cancer cells consume a large amount of energy, forcing the body to burn fat and muscle to keep up. As the body continues to lose weight, muscle strength declines, energy levels drop, and daily tasks may start to feel exhausting. Clothes may fit more loosely, and others might notice the change before you do. This type of weight loss happens gradually, which is why it's often ignored or blamed on stress or aging. Unplanned weight loss is not just a cosmetic change. It can be a sign that the body is under serious internal stress. Recognizing unexplained weight loss as a possible symptom of colon cancer and seeking medical advice early can play a crucial role in detecting the disease before it reaches an advanced stage. Number 12. Bloating. Bloating can be an early and uncomfortable sign of colon cancer, and it often feels like constant pressure or fullness in the abdomen. Under normal conditions, the colon helps move waste smoothly through the body while absorbing water. This process keeps the digestive system balanced and comfortable. When colon cancer begins to grow, it can partially block the inside of the colon. This slows down the movement of waste and gas. As gas builds up behind the blockage, the abdomen may start to feel tight, swollen, or stretched. This bloated feeling may not go away easily and can return day after day without a clear reason. Unlike occasional bloating caused by food, this type of bloating may feel deeper and more persistent. The stomach can look visibly swollen, even without eating large meals. Some people notice that their abdomen feels firm to the touch, especially later in the day. This ongoing pressure is a sign that the digestive system is not working as it should. Over time, constant bloating can affect comfort and quality of life. Simple activities like sitting, bending, or sleeping may feel uncomfortable. Because the symptom develops slowly, many people dismiss it as a normal digestive issue and delay getting it checked. Persistent bloating is not something to ignore. When it happens without a clear cause and lasts for weeks, it may be the body's way of signaling a deeper problem in the colon. Paying attention to this change and seeking medical advice early could help detect colon cancer at a more treatable stage. Number 13. Pelvic pain. Pelvic pain can be a less obvious but important sign of colon cancer, especially as the disease begins to affect nearby areas. The lower part of the colon sits close to the pelvic region, where many nerves and tissues work together to support normal bowel function. Under healthy conditions, this area remains pain-free and comfortable during daily activities. When a tumor grows in the lower colon, it can create pressure within the pelvic space. This pressure may irritate surrounding nerves and tissues, leading to a dull, aching pain or a constant sense of discomfort deep in the pelvis. The pain may not be sharp, but it can feel heavy or persistent, making it hard to ignore over time. Unlike temporary aches caused by movement or posture, this type of pelvic pain may appear without a clear reason. It can come and go or remain steady throughout the day. Some people notice it more when sitting for long periods or during routine activities, even though nothing unusual seems to be happening. As this discomfort continues, it can affect focus, sleep, and overall well-being. Because pelvic pain is often linked to muscle strain or minor issues, many people delay seeking medical advice. This delay allows the underlying problem to continue unnoticed. Ongoing pelvic pain that doesn't improve should not be dismissed. When it appears without an obvious cause, it may be the body's way of signaling trouble in the colon. Recognizing this symptom early and getting it evaluated can be an important step toward timely diagnosis and better treatment options. Number 14. Constipation. Constipation can be an early sign of colon cancer, especially when it appears suddenly or becomes ongoing without a clear reason. Normally, the colon moves waste through the body in a steady and coordinated way, allowing regular and comfortable bowel movements. When a tumor begins to grow inside the colon, it can narrow the passage where stool moves through. This makes it harder for waste to pass normally. As a result, bowel movements may become less frequent, harder, or more difficult to complete. You may feel the urge to go but struggle to empty your bowels fully. This type of constipation often feels different from occasional digestive slowdowns. It may last for weeks, return often, or slowly worsen over time. Standard remedies like drinking more water or changing diet may bring little or no relief, which can be frustrating and confusing. As constipation continues, it can cause discomfort, pressure, and a sense of heaviness in the abdomen. Daily routines may start to revolve around bowel habits, and concern grows as the body no longer follows its normal rhythm. Persistent constipation should not be ignored, especially when it's new or unexplained. It can be a sign that something is blocking normal movement in the colon. Paying attention to this change and seeking medical advice early may help catch colon cancer before it progresses further. Number 15. Narrow or thin stools. Narrow or thin stools can be a subtle but meaningful sign of colon cancer. Under normal conditions, stool passes through the colon with enough space to form its usual shape and size. When the colon is healthy, Bowel movements tend to look consistent over time. As a tumor grows along the inside wall of the colon, it can reduce the available space for stool to pass through. This causes stool to come out thinner than usual, sometimes looking pencil-like. This change may happen gradually, making it easy to overlook at first. Unlike temporary changes caused by diet, this narrowing can continue for weeks or even months. Each bowel movement may look noticeably slimmer than before, even though eating habits haven't changed. This consistency is an important clue that the issue may not be minor. Over time, this ongoing change can raise concern, especially when the stool shape doesn't return to normal. Because there is usually no pain at first, many people delay getting it checked. A lasting change in stool shape should always be taken seriously. Narrow or thin stools can be the body's way of signaling that something is restricting the colon. Recognizing this sign early and seeking medical advice can help identify colon cancer at a stage when treatment is more effective. Number 16. Fatigue and weakness. Fatigue and weakness can be early signs of colon cancer that often go unnoticed because they develop slowly. In a healthy body, energy levels are maintained through proper digestion, nutrient absorption, and balanced blood levels that deliver oxygen to tissues. Colon cancer can disrupt this balance in several quiet ways. Slow internal blood loss from the colon can reduce iron levels over time, lowering the body's ability to carry oxygen. When this happens, even simple activities can start to feel exhausting, and the body feels weaker than usual. This kind of fatigue is different from normal tiredness. Rest and sleep may not bring relief, and energy levels remain low throughout the day. Muscles may feel heavy, and tasks that once felt easy can require more effort and concentration. As weakness continues, motivation and focus may decline, affecting work and daily routines. Because fatigue is common in busy life, many people blame stress, age, or lack of sleep and ignore the warning. Ongoing fatigue and weakness without a clear cause should not be dismissed. When the body feels constantly drained, it may be signaling an underlying problem in the colon. Paying attention to this symptom and seeking medical evaluation early can support timely diagnosis and better treatment outcomes. Number 17. Nausea and vomiting. Nausea or vomiting can be a warning sign of colon cancer when it happens repeatedly without a clear cause. In a healthy digestive system, food and waste move smoothly through the intestines without triggering ongoing discomfort in the stomach. When colon cancer affects the normal flow inside the colon, waste can begin to back up. This disruption can send signals to the stomach, creating a constant feeling of nausea. In some cases, the body reacts by vomiting, as it struggles to handle the digestive imbalance. This type of nausea often feels persistent rather than sudden. It may appear even when you haven't eaten much and can make meals feel unappealing. Vomiting may occur without food poisoning or illness, which makes the symptom confusing and easy to ignore. Over time, repeated nausea can drain energy and reduce daily comfort. Simple activities may feel harder, and the digestive system never seems to settle. Because nausea is commonly linked to minor stomach issues, many people delay getting it checked. Ongoing nausea or unexplained vomiting should not be ignored. When it continues without an obvious reason, it may be the body's way of signaling a deeper issue in the colon. Recognizing this symptom early and seeking medical advice can help support earlier detection and more effective treatment. Number 18. Loss of appetite. Loss of appetite can be an early and often overlooked sign of colon cancer. Normally, the body sends clear hunger signals that encourage regular eating to maintain strength and energy throughout the day. When colon cancer develops, it can disrupt these signals. Changes inside the colon may trigger inflammation and chemical signals that affect how the brain controls hunger. As a result, food may no longer feel appealing, even when the body needs nourishment. This loss of interest in eating often happens gradually. Meals may feel like a chore, portions become smaller, and favorite foods may no longer bring enjoyment. There may be a feeling of fullness after just a few bites, without overeating. Over time, eating less can weaken the body and reduce daily energy. Because appetite changes are common during stress or busy periods, many people dismiss this symptom and don't look for an underlying cause. A lasting loss of appetite without a clear explanation should be taken seriously. It can be a sign that the body is under internal strain. Paying attention to this change and seeking medical advice early may help detect colon cancer before it reaches a more advanced stage. If you noticed any of the symptoms we discussed today, even if they seem mild or come and go, please don't ignore them. Colon cancer often stays silent until it becomes serious, and early detection can make a life-saving difference. Your body speaks in signals: rectal bleeding, blood in the stool, changes in your bowel habits, unexpected weight loss, unusual fatigue. These are not things to overlook. You deserve answers, and you deserve peace of mind. So if something doesn't feel right, talk to a healthcare professional. A simple checkup, a scan, or even a basic examination can give clarity and potentially catch a problem before it becomes dangerous. Remember, awareness is the first step, action is the second, and your health is worth both. If you found this video helpful, share it with someone you care about. You never know who might need this information today. Take care of yourself, listen to your body, and I'll see